Hello and welcome to the show. We continue our discussion on the importance of the HIV Workplace Advocacy Unit, which is a unit under the Ministry of Labour. We are continuing our conversation with two other client organizations who are partnering with the HIV Workplace Advocacy Unit. Learie Hinds. He is the Human Resource Manager at Amalgamated Security Services Limited, and Letitia Cox, the Industrial Relations Officer and a registered mental health nurse, and she's representing the Trinidad and Tobago National Nursing Association. Welcome.
Thank you for having me.
We're going to start with you, Larry. Tell us a little bit about Amalgamated Security and how your organization came to partner with the unit.
Amalgamated Security Services Limited is one of, if not the largest security company in Trinidad and Tobago, and has grown tremendously in the region as well. We are in, right now, about 8 locations.
8 locations.
In the region.
Wow.
Yeah. Our service extends beyond just the normal security service that you see, officers standing guard or patrolling, or the vehicles that go up and down. We are also into technology in a big way. Cybersecurity and other areas of technology and so on. We provide services to any and every aspect of life in the region. Commercial, residential, private security, investigative work, cash in transit and valuables. We move property, people's property, valuable property across the region and from place to place if we need to and so on. We pride ourselves in the fact that we are homegrown. We have been Trinidad and Tobago all along, and now we are the Caribbean.
Right. And what about you, Letitia?
Well, I'm here representing the Trinidad and Tobago National Nursing Association, which is both a national professional association and a union. So we represent the interests and rights of nursing and midwifery personnel. And of course, most of our, or I should say executive of all, nursing personnel. So we, of course, are enshrined in duty of care to the public of Trinidad and Tobago, and I'm happy that I'm also sitting with another essential service. And coming out of COVID-19, you know, nurses would have gone through so much, but we remained dedicated to serve. So joining on in this whole advocacy where HIV and AIDS is concerned, it was very easy for us to join on this, how I should say, this initiative, because of course, for us, this is close to us. We are actually one of the first persons who would encounter persons who are positive with HIV and AIDS, and we have an awesome responsibility with that regard.
Okay, now staying with you, Letitia, were you aware of the unit before the initial engagement?
No, we were not aware. The association definitely wasn't aware. But as soon as we were contacted, we were happy and we signed a memorandum of understanding with the ministry, because this is a very important issue, this HIV and AIDS. Yes, and that was between the period 2018 to 2020 when the ministry would have reached out to us.
Okay, and what about you, Larry?
Well, for us, our primary objective in this initiative is one which embraced our inclusivity principle. We have always felt that HIV and AIDS as a workplace issue shouldn't have been really singled out, because there are other workplace issues alongside that which we have always given consideration to and strive to ensure that the best, safest, most comfortable workplaces are established for all of our employees. And coming to know of the HIV Workplace Advocacy Unit, we were encouraged and quite pleased to partner with them because we were happy to know that there was another organization, albeit at a national level at that was really promoting the same values that we held to. So we were very happy to join them and to be a partner with them. We deepened our understanding and our appreciation for what they do when we signed the memorandum of understanding and came to know a little more of the work that they have been doing all these years.
Okay. And your organization has a policy with regard to HIV and AIDS and the workplace. How difficult or how easy was it in terms of developing the policy?
Well, for us, we don't want to sound as though we're boasting, but we do have some very robust policy structures in place. And maybe we should boast about it because we do.
I think you should. I think you should, yes.
And ideally, we have been working with policies and procedures because of the standards that we hold to and the international guidelines that we have to uphold through ISO, the local guidelines at STO, and the ANSI guidelines for security industry and so on. So developing this policy was not as challenging or difficult for us as if it weren't for these standards and these structures that we already have in place. So when we engage with the HIV Workplace Advocacy Unit, it was very easy for us to transition simply by expanding on our own policy that dealt with non-discrimination in the workplace.
Okay. And for your organization, Letitia, I know that you, as an organization, you also work with other nurses within other organizations as well. What was that process like in helping to develop workplace policies with regard to HIV and AIDS?
So, to be honest, we are actually still putting together the hard copy of our policy, but we have come a long way and we are in the final stages. But what I can say, we are close to getting what we call in union recognized majority union status, and we have started our collective agreement, and I'm happy to say that within that collective agreement, we have clauses for HIV and AIDS and discouraging discrimination and the grievance process with respect to HIV and AIDS. So we have made strides, and I also want to say, whilst before we didn't see it as something that was so glaring to address, because for nurses, it's inculcated in us not to discriminate, because we interact with patients with various infectious diseases, and of course we have to be confidential. We have to treat them with the same care and respect and passion, compassion and love. So, but I see it as a proactive step, so that anybody coming after us in our organization will understand why it's important to not discriminate.
Yeah. So now that your process is it's in development, almost to completion, what was that process like?
I would say managing the various responsibilities. So if anybody knows about an association or a union and dealing with matters, and of course they will come to the go-to persons who they know will achieve something or get something done. So it's time management. So I think that was the biggest challenge in getting the policy together, was managing the various responsibilities, but we are getting it done.
Okay. And I mean, your process was easier because, of course, you said that you have other types of policies in place already as part of being a security unit. But what were some of the challenges that you may have experienced in putting together this particular policy?
I think the biggest challenge for us, or if we want to call it that, it was more of an adventure than a challenge, was the fact that we needed to create the awareness, go out onto the communication and education bandwagon kind of thing, so that at the end of the day, we were engaged in communication with our stakeholders internally, and trying to get the buy-in and so on, which thankfully we got from top management quite easily. So really, we didn't have much of a challenge. Once top management came on board and the communication filtered down to the rest of the organization, it became easy for us to transition through the process. And of course, the support of the HIV Workplace Advocacy Unit did lend considerably to how well we were able to overcome this.
Are your members of staff susceptible to the programs and initiatives that would come about as part of the policy? What was their response like?
Oh, certainly, certainly. The response was good, quite good. When we first rolled out or introduced the concept to our senior management team at one of our quarterly management meetings, which we tried to do new things each time to bring new policies and so on board. It was well received. People were very, very receptive and encouraged all of us as a team and the rest of the organization to get on board and to support it.
We'll take a quick break and come back with more. Stay with us. Thank you for staying with us, Letitia. What do you think could be included, or has it been included? You could mention that as well, to enhance the policy and the program development of the policy?
Well, I think what would be really good to have, if we can get some data in terms of when persons or maybe organizations who have breached the policies and what information, how it was treated with, how did they deal with breaches of the HIV and AIDS policy and how they responded, where did it go, what sort of mechanisms and systems were put in place. I think that would help us in terms of being proactive and putting things in place in our policy to treat with those issues going forward. And I think other organizations would benefit from that information. So being a data hub, for us, I think that would really be beneficial.
Okay. Yes. And in terms of your members, how susceptible are they when it comes to a policy like this?
Okay, so the Nursing Association is sort of unique because we also have employees in our office and the policy is being crafted for the employees of the office, right? So they were, it was well appreciated and welcomed. Our first encounter was a nice workshop session that was hosted by the advocacy unit, and that went well. We also expanded it to include our association branches because we are made up of branches throughout Trinidad and Tobago. So our first vice president would have set up in our branch meetings to talk about the policy. And we also expanded it further by including the joint trade union movement, who we are a part of that federation. So yes, we have been doing some work and in spreading the good news, as it were, the gospel.
How can you see the relationship progressing further?
Well, I see us continuing with sensitization workshops. I think we can also do some more work in the media. I think the Nursing Association would be happy to partner with the HIV, advocacy unit to spread the good news, as it were. I want to repeat that again, and attack stigmatization. Because as a nursing professional, a healthcare professional, there's a lot of stigma. And it keeps our vulnerable persons from getting help and from also preventing the spread and from also accepting treatment. So yes, I see us having a really good, close relationship going forward, professional one, that is.
Yeah. And for your organization, Learie, how can you see the relationship between Amalgamated Securities and the HIV Workplace Advocacy Unit progressing?
Well, for sure, we are going to be continuing our partnership with them. We will enhance and deepen our collaboration with the HIV Workplace Advocacy Unit. and encourage our staff as well by way of information flow. We want to ask the unit to continue to do what they are doing and to provide as much information as possible, research-driven data, to communicate more, continue to communicate more, and if I may say so now, ask the media to give support there. And hopefully at the end of the day, we would all come on board and understand and appreciate the good work that the unit is doing. And certainly I encourage all organizations to come on board.
Yeah. No, that was actually my next question. You know, what message would you give to other organizations who may be considering, who maybe have not considered, you know, signing on to programs like the HIV/AIDS, you know, policies, getting them formulated? What message would you give to them, and how you know, tell them the benefits,
Well,
essentially?
it goes without saying, the message is join, come on board, get with the program. There could hardly be any reason why an organization, any employer, will not want to be part of this program, especially since the issue that we are discussing is one that can and has impacted the efficiency in workplaces all across the board, all across the country, across the world. So I don't know that any employer would need much encouragement in terms of finding ways and mechanisms to alleviate the issues that are likely to arise that may impact productivity negatively. So our message to our colleagues in the world of work is partner with the HIV Workplace Advocacy Unit, seek their guidance and advice, develop the policy, communicate it to your staff, ensure that they understand, and create an environment of inclusivity. Create an environment that says, this is a safe place. We have safe systems of work, and we have a culture that does not discriminate. Yeah. That is the message we will leave them with. Yeah.
And what about you, Letitia? What message would you like to give to other organizations, other employers, in, you know, following what your organization has followed in joining with the Workplace Advocacy Unit?
No problem. And allow me to address the public. Sure. Address or deal with the elephant, the white elephant in the room. Because a lot of times we do not want to touch it. It hasn't come up. It's best we don't address it. It is better to be proactive than reactive and wait for an issue to happen in your workplace and then find yourself in costly litigation or even harming someone where they may even harm or take their, harm themselves. Because as a nurse, I know there are instances where persons would have taken their lives. Or they may have ended up in the hospital, a psychiatric hospital, because they can't cope with what is going on with them. So I implore you, as a responsible employer, I'm imploring you, please, partner with the advocacy unit. Create a policy to create a very conducive and well environment where you would promote the mental health and well-being of your workers. You don't have to wait. This is a good initiative. Join. Come on board.
Yeah. And I don't think I could say anything to follow that. I think you both encapsulated accurately and passionately about the unit and your role in implementing it and ensuring a safe space for all of our workers in Trinidad and Tobago. And that's our show. I would like to thank our guests, Learie and Letitia, and Cindy and Michelle, for taking the time out to talk to us about their partnership with the HIV Workplace Advocacy Unit. And from the entire crew at TTT News, thank you for joining us.